Hi, Dr. Jeff, and I'm going to talk a little bit about why you have plantar fasciitis, or more importantly, why plantar fasciitis is so hard to treat. Now, if you're watching this, okay, you got pain in the bottom of the foot. I already know you've researched a lot on the internet about plantar fasciitis, all right? If you think you got plantar fasciitis, you're thinking you got pain right in the bottom of the foot. You wake up in the morning, extremely painful to walk because that plantar fascia is getting stretched out. Okay. Now, a common treatment of plantar fasciitis is obviously stretch the calf and stretch the bottom. But let me get a little ahead of myself. When you have a condition like plantar fasciitis or Achilles tendonitis or runner's knee, you got to have two diagnoses. One, what's the problem? And that would be, let's say, plantar fasciitis. But diagnosis number two is what actually caused the plantar fasciitis. And that's one of the reasons why plantar fasciitis is so hard to treat. That's why runner's knee is hard to treat. And that's why Achilles is so hard to treat. Because everybody is focusing on the first diagnosis about what is the problem. And that's the pain about the foot, the plantar fasciitis, or Achilles tendonitis. And they're not looking at what actually caused the tendonitis, or what's actually causing the stress in that particular area. And that's why it's often misdiagnosed. And that's why the treatments aren't working, okay? Because if you got pain in the bottom of the foot, if all you're focusing on the bottom of the foot, that's the result of a bunch of different conditions usually, and not just the one condition, if that makes sense to you, okay? Meaning, when someone comes into our office who has plantar fasciitis, or and most of the time they say, I have plantar fasciitis, or I got pain in the bottom of the foot. That's nice, okay? We're going to put you through a functional exam, or on your own you need to do some type of functional or biomechanical exam to determine all the imbalances, muscle weakness, or adhesions you have throughout the whole lower extremity, throughout the foot, the ankle, the knee, the calf, the quad, the glutes. And most people aren't doing that, okay? And that's why you're doing deep tissue on the bottom of the foot, and you're getting maybe a little bit of result, but you still can't run, or you still can't walk. So let me get a little bit into detail about some of the things you should talk to your doctor or therapist about, okay, if you're suffering from plantar fasciitis. And this goes beyond just plantar fasciitis. This is Achilles tendonitis, runner's knee, any pain, okay? So but basically in plantar fasciitis, you're going to have that pain in the bottom of the foot. And it causes by usually the arch stretching out, okay? So, one thing you want to do is look at your arches, stand up, and see if you're dropping down like that. You can look in a mirror from behind and see if you have, excuse me, my drawing is not very good. But if you have like an L, so if your Achilles is going down and then you're bending into the side, okay? If you're getting something like that going on, you need to correct that with like an orthotic, with like a medial heel wedge. A wedge would be, so if you're pronating down, you build up a wedge on the inside orthotic that's a little thicker than the outside. So it'd be something kind of like that. And what that's going to do is just going to help that foot rotate, okay? I mean, stop it from pronating even more. Over-the-counter stuff is okay, but that stuff usually isn't thick enough and support enough to stop your foot from rolling in. I personally don't like a real bunch of heel cups and a real hard orthotics. Basically something to an orthotic stop you going from too abnormal, okay? So we first need to address the rotating in the side. Next thing we're going to do is we got to look at this ankle mobility, okay? And a good way to assess the ankle mobility is keep your foot flat on the floor, so keep your foot flat on the floor, and bring your knee as far forward as you can, keeping the ankle on the floor. And you should be about 5 inches or more. So you're basically bending the knee, so your foot's on the floor so your foot's on the floor. Bring that knee far up as you can. Okay? And that distance right there should be about 5 inches or more. If you're bringing your knee forward and your heel is coming up before 5 inches, you may have mobility issues within the ankle and restrictions within the calf, or both. Okay, so if you're having something like that going on, this needs to be addressed with some type of mobilization exercise or adjustment to the ankle. Next thing we got to do is we got to look at all the fascia in the muscle. We got to look at not only the fascia in the muscle. Everybody comes in and says, well, I'm doing stuff for deep tissue on the bottom foot. That's great, but there's a huge problem up here in the calf, okay? Particularly on the inside of the calf. If this is the inside of the calf, go feel up in this area. And just get in there with your thumb, and you're probably going to find that trigger points and adhesions. And trigger points or adhesions are basically, if this is the back of the calf, if you're a runner or do a lot of walking or whatever, you get a little tear in that area. Okay? And the body just doesn't heal a tear like that. What it does is it crisscrosses like this. Okay? So you get all these little adhesions within the calf. You get the adhesions and stuff like that in the plantar fascia too. Personally, I have such a big adhesion, my plantar fascia, I have a huge nodule in there like that. Okay? So if you're feeling that tightness in there, we need to break that type of stuff up. And you break that up with like what we call like an active myofascial release, where you basically get in there, take a contact on that adhesion, and then lengthen the muscle, and you break that up. So the therapist will grab that in there and break that up. You could try foam rolling it, you could try doing the stick work, but obviously that stuff's not going to last that long. That works a lot better when you combine it with manual breaking it up. So one of the reasons why plantar fasciitis and Achilles tendon, the same thing. You got the tendon going down here, you got all that inflammation right there at the tendon, and what do? If you do an injection in there, what's that going to do? Well, that's going to help the localized swelling in the area. But remember, diagnosis number 2, why did you get the Achilles tendonitis in the first place? Do you have adhesions up here? Do you have hypermobility of that ankle? Are you pronating or supinating? Like I said, usually you have maybe a combination of a bunch of all these little things. So if you're suffering from an injury, you got to look above, below, all around the area. Everything just needs assessed. You need to assess the foot, the ankle, the calf, the knee. And most places are just focused on it, or if you've been suffering from some type of condition like this for a long time, and you've had a lot of treatments, look back and has the treatment been focused on just the area of the pain, just the plantar fasciitis, or just the Achilles tendonitis? Have you looked at the arch support? Have you looked at ankle mobility? Have you looked at the deep tissue adhesions throughout the whole foot and the calf? Not only the calf, all the way up into the glutes. Okay? Tight glutes, all that. It's a chain reaction. Okay? It's a chain reaction. I tell my patients all the time, imagine just getting off the table and putting one shoe on and the other shoe being barefoot and walking on with one shoe on. That's kind of like the imbalances that all this stuff could happen. And if you're not looking at the whole picture, that might be why you're suffering from the problem, for the Achilles tendon problem, for the plantar fasciitis problem. So look in the whole area. There's a lot more going on than the area of the pain. So I hope that helps. If you have any questions whatsoever, please feel free to drop me an email or a phone call.